You know, there's various forms of tendonitis that you can get on your feet. You can get what's called extensor tendonitis on the top of the foot, where you've got pain and inflammation and a tightness that you feel. There's other types of tendons that travel down from the leg down onto the feet, and so there's various forms of tendonitis regarding that. I touched earlier about neuromas, which are inflamed nerves. And generally that's caused due loading and pressure in an area. Usually most people will get it on the ball of their foot, and they'll feel like this sharp shooting pain, or someone's sticking them with a needle, or they feel like, hey, you know, feels like my socks are bunched up in my shoe all the time, or I feel like I'm walking on a pebble. It's weird, doc. You know, it feels like there's a rock in my shoe, and I look in there and there's nothing in there. And I educate them and say, well, you know, what's happened is due to your foot type and all the loading and pressure that you put on the balls of your feet, you've caused the nerve in that area to balloon up and get inflamed. And nerves are funny because they can manifest in different types of pain modalities, such as the sharp shooting pain, burning, tingling, numbness, someone sticking you with a needle. So it's totally different than when you get tendonitis or muscular problem, because that tends to be more along the lines of a dull, achy pain. Similar to, again, plantar fasciitis. So more of a dull, achy pain. Another thing that I do that is cutting edge right now, and you're seeing it with a lot of professional athletes, is platelet injections, which is similar to like stem cell injections. And Kobe Bryant, I would figure Kobe Bryant and Tiger Woods made it more famous publicly. Kobe Bryant had it done 3 times in his knee due to the fact he has a bad case of arthritis, and it really rejuvenated his career. Tiger Woods blew out his knee, and the platelet injections helped him get back into the game. I basically take your blood, and from that I spin it in a centrifuge, and what that does is it separates your blood plasma and your platelets. And then from there, what I'll do is I'll extract your platelets, which are basically immature cells. I'll extract that, and then for instance, let's say there's chronic area in the plantar fascia that's been bothering you, and generally when you have a chronic issue, usually there's tissue damage. So I'll inject your platelets into the area of chronic tissue damage, and then the immature cells form into the tissue, and they replace the damaged tissue with brand new tissue. The other thing that's fantastic about this is that it also develops a bunch of blood vessels. And if you remember what I had said before, the plantar fascia, tendons, ligaments, very low on blood supply. That's why they tend to become more chronic in nature. And so with the development of a bunch of blood vessels, now your plantar fascia becomes like a super plantar fascia, because now it can heal itself a lot better by releasing a lot of healing factors through the blood. So you've got tissue replacement and then a formation of a bunch of blood vessels. And I have probably a 95% success rate with that, and I've used it not on the feet, I've used it on the legs, the calves. This works on knees, shoulders, hips, really anywhere in the body, including, like I had mentioned before, osteoarthritis in the joints. It can actually help to reduce the symptoms of that. Yeah. This is basically, we're in the early stages of this, and I would say in 10 years from now, it's just going to be a common instrument to use to help treat and cure ailments. I spoke with Pau Gasol when he was a Laker. He had torn his plantar fascia, and he got platelet injections right away. And he was back on the court in 4 to 6 weeks, which is insane when you tear your plantar fascia. Usually that takes months and months in order for you to get back into competing again. There's various forms of tendinitis that you can get on your feet. You can get what's called extensor tendinitis on the top of the foot, where you've got pain and inflammation and a tightness that you feel. There's other types of tendons that travel down from the leg down onto the feet, and so there's various forms of tendinitis regarding that. I touched earlier about